Welcome to Clyde Ellis Medically Speaking and our special series on the fight against the coronavirus. As you can see, we have modified our format to practice safe social distancing while providing timely and factual updates from the Clyde Health team during this public health crisis. We as a healthcare organization believe it's important for the Western New York community to hear from our medical experts who are leading the charge in our facilities and with our workforce of over 10,000 strong. I'm Mike Hughes, and this is Medically Speaking. Dr. Melissa DeSantis is an emergency room physician at DeGraff Memorial Hospital in North Tonawanda. Dr. DeSantis, thanks for joining us today.
You're welcome.
So as an emergency room doc, you are on the front line of the COVID-19 public health crisis. If you can, tell us what it's like at the hospital, really what you guys have been dealing with for the past, say, 4 to 5 weeks.
So we've been seeing a wide array of patients. We've been seeing some of our bread and butter emergency medicine patients, those with orthopedic injuries, chest pain, strokes, not as much as we've seen in the past. We're seeing more patients with COVID symptoms, a wide array of patients with minor illness like respiratory issues, cough, cold, shortness of breath, to more severe patients with respiratory issues requiring respiratory support and mechanical ventilation.
So talk about those patients, if you can, for a second. Are they coming in and they're stable? Are they coming in very, very sick? Is it a combination? So what kind of patient mix, specifically for those who you suspect that might have the coronavirus, what kind of patient mix are you seeing?
I think there's a mix of what we call the walking well, those that really are not very sick. They have normal vital signs, normal respiratory rate, normal oxygen level, all the way down the spectrum to those that are very ill, actually, that are acutely short of breath and require help instantaneously. So we are seeing definitely a mixture of patients.
So if you can, explain a little bit how this has changed the way you practice, not just from a personal protection and equipment perspective, but how this has changed the way you practice medicine right now.
Sure. I mean, these are very uncertain times that we're dealing with, and we've tried to come up with creative ways to practice medicine. One of the one of the ways we've been practicing is using telephone more to speak with patients. So at the nurse's station and doctor's station, we have telephones, and we have the phone numbers of all of the patient's rooms, and we can actually take a history over the telephone and spend more time talking to a patient and obtaining history that way versus face-to-face contact. We can also update them of test results as they progress throughout the visit, and even give them discharge instructions over the phone, which is nice because that not only limits our exposure to potential COVID-19 patients, but it also helps the patient not be exposed to us too much, as we could be potential carriers, of infection as well. So we've had to change, management from that standpoint. Also, routine shortness of breath patients, when they come into the emergency room, in the past, we would give a breathing treatment. But, because of COVID-19, we've had to limit some breathing treatments due to concern over possible risk of aerosolizing the virus. So, we've had to make some modifications here and there with things, but we're adapting.
So as part of that adapting, DeGraff is the newest emergency room in Western New York. Has that new layout and the expanded emergency room helped in this case?
Yes, I think it has actually. The private rooms, the fact, like I said, that each room has a telephone, it really has helped to keep the patient safe and secure. Because they're in their own room, we're keeping the doors shut at all times, so to prevent any type of spread of the infection around the emergency department. So it's not only helped the patients, but it's also helped the staff as well.
Sure. So we've talked about the facility, we've talked about the patients. If you can, tell us a little bit about the staff. How are they holding up, the nurses? yourself, your fellow physicians, the ancillary staff that are so vital to the emergency room. How is the staff holding up at this point?
I think we're all doing pretty well. We're all supporting each other. I know it's an anxious time for everyone. Not only are we worried about ourselves, but the patients, but also our families as well. But we're all trying to pitch in. We're all on call. We've asked to be on call for shifts when we're not working, so that if someone gets sick, we can come in and help. Or if we get a surge of patients, is someone willing to be on call to come in? And everyone really has been trying to support each other, and not just from a doctor's standpoint, but nurses, housekeeping, dietary, secretaries, registration, security. We've all tried to support each other in different ways, answer each other's questions. We do Zoom videos weekly to see how we're all doing, dealing with unprecedented times. So.
Sure. As we wrap up here, it seems that there's a sense of calmness, confidence, that we're managing through this as an organization, especially those on the front line, that they've been well prepared for this. Is there any message in particular that you would like the community to know about, or to hear from you as someone that's on the front line and seeing this every day that you work? What would you want the community to hear?
Sure. We've had such an outpouring of support from the community. Every day when I go into work, there's tons of food from local restaurants, and Girl Scout cookies, there's pizza, there's, Rachel's restaurant has sent us food, the Pagula Family Foundation, there's people sending in N95 masks and surgical masks. And I just, want to say thank you to the community for helping us. We really do appreciate that. And also, if you are sick, don't be afraid to come in. That's what we're here for. That's what we're trained to do. We're emergency room doctors, and that's why we all went into ER in the first place. So, don't hesitate to come in if you have chest pain or stroke symptoms or ankle sprains or lacerations. That's, what we're here for. And, that's what we got trained to do.
Sure. Dr. DeSantis, thanks for joining us today. We appreciate all that you guys are doing at DeGraff Memorial Hospital in the emergency room and dealing with these patients and this public health pandemic at this point. So thanks for joining us.
No problem. Thank you for having me.